Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, boys and girls, welcome to the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K. Thank you guys for joining us as today we discuss vitamin C and high-dose vitamin C. We're going to talk about how much of it to take, what benefits you get from it at different doses, why some people take it, immune stacking spotlight, and a couple myths about it as well. So let's get into it.
Right on. Well, but we're talking about vitamin C today. I'm going to go ahead and ask you to start off. What is vitamin C and why do we need it?
Vitamin C is basically the building block of collagen, if you really think about it at a molecular level, but it has functions in a whole bunch of different things because it's a cofactor. So it's used in, obviously, tissue building through collagen. There are doctors using it for cancer treatment. And then also people take it for their immune system, to boost their immune system when they're sick. And that's kind of the three main headlights of it. It is also used in cosmetics. You know, people put vitamin C on their face to make them look younger. You can do IV vitamin C for anti-aging, tissue rebuilding in the face benefits. Don't inject vitamin C in your face, do it IV.
I've heard that people put like IV in their shower water. So it vitamin C in their shower water. So it sprays vitamin C in their hair when they shower.
I mean, sure. That'd be very sticky because vitamin C is sticky. And then two, it would just wash out. That's, I don't know.
I know it's a whole category of shower heads now.
Okay, I don't know enough about that to say anything. That fall into the same line as stem cells in cosmetics when they're putting plant stem cells in your topical makeups. And they're like, oh, well, there's stem cells in these products, use them. And then when you actually look into it, you're like, this is just a waste of money. It's a marketing scheme.
Hey, a lot of things are marketing schemes. So, but back to vitamin C. Most people think of vitamin C, they think of eating an orange a day, keep the doctor away type stuff.
Yeah.
So what are you talking about? Are you talking about dietary consumption, IV? Are you talking about taking it orally? What's the best or most efficient way to do this?
Well, so I'm talking about IV and oral. So eating one orange will get you 50 milligrams of vitamin C. You know, not a very big number. What I'm talking about starts at 1 gram. So if you're sick and you're trying to boost your immune system, you're looking for the antioxidant effect where it fights free or radical oxidative species. So basically, it's just these things that are made when you get sick. Vitamin C will combat them, lower them, boost your immune system, try and stimulate your immune system. That's 1 to 2 grams, maybe 3 grams taken by mouth. Taking more than 4 or 5 grams by mouth is rough because vitamin C is super acidic. So oftentimes people will get diarrhea if they take too much. But this is the vitamin C everyone knows about. Oh, you're sick. Let me take one of those off-the-shelf vitamin C supplements and maybe it'll make me feel better. And it definitely works. It boosts the immune system a little bit.
I've actually found that depending on how sick the person is or depending on the level of need they have for the vitamin C is how much they can actually tolerate orally. So if you take a gram every 30 minutes, and you're very sick, you can actually take many more grams than if you're not sick.
I guess because if you're sick, you're burning through it, and so you basically have space to take more.
Yeah, some days they can do 2 grams, some days they can do 10.
Interesting. I wonder if there's any studies about that showing, how much you can take depending on how sick you are. That'd be a really hard thing to study.
Yeah, anybody who's listening, if there are studies, we'll put them down there.
Yep. Okay, so vitamin C under 15 grams, 15 grams, is an antioxidant effect. Immune system boosting, fights ROS. Over 15 grams is what we start to get into is called high-dose vitamin C. And this is a completely different ballgame. This vitamin C, we're talking, has a pro-oxidant effect. So it stops fighting inflammation and actually starts to support healthy inflammation or building of tissue.
So this is like a hermetic stress, if you will. This is like doing a cold plunge or doing a sauna, where it's not necessarily reducing inflammation on its face, but it kind of gives a stimulus to reduce inflammation in the long run.
I'm not sure I would actually classify it as a hermetic stressor. I think it truly, a pro-oxidant is not the same thing as a hermetic stressor.
Okay. So when you say tissue building, what are you talking about? Tissue building.
Vitamin C is the collagen. Most of our soft tissue is made of collagen. Collagen is made of vitamin C. It just literally stacks of vitamin C on itself. That's where you give yourself enough vitamin C, you're going to start building more collagen. And then that's going to turn into muscle tissue, soft tissue. So a couple of different benefits are, post-regenerative injections. I have all my patients take high-dose vitamin C as a booster, just to boost the injection, specifically with the stem cell injections. I don't require it so much with the PRP and Prola, although it would be good if they did it. And then there is the cosmetic form of it. I've had a number of women that do high-dose vitamin C just because it makes them look younger. And then it does stack a little bit. Each one you do makes you look a little bit younger and fresher, brightens up the skin, a little bit of anti-aging, a little bit of anti-wrinkle appearance. And that's without doing any physical changes to the face.
Yeah, I like that. No little micro needles or injections. Internal youngening, if that's a word.
Yeah, because it's anti-aging you from the inside out.
That's how you're supposed to do it. That's the best way to do it. So, tissue building, high dose vitamin C. Are you saying that if I took like 100 grams of vitamin C on an IV and then went after a workout, I could like put more muscle on?
I think that there's a limiting factor to how much muscle you can put on per vitamin C IV. In theory, yeah, it would help.
It would just give it more raw materials. It would most likely depend on the signal I sent in the gym and how hard I worked out and that kind of stuff.
Correct. This wouldn't replace something like testosterone for muscle building, but it's a small boost.
Gotcha. And if you're taking high doses or medium doses regularly after you work out, it actually could reduce your actual muscle building ability because of the antioxidant nature. It reduces the inflammation. Doesn't let the body send as loud of a signal. But we're talking like medium doses, so not into that high tissue repair dose, but toward like 3-4 grams. Yeah.
That's not an amount I would recommend people take every day because you're not really going to get much out of it every single day. And then, you're going to inhibit things.
Don't want to inhibit muscle growth.
No. And so as long as we're talking about high dose vitamin C, one of its more popular uses in quote unquote alternative medicine is there are a number of doctors that are using it for cancer treatment. The way that vitamin C in high doses responds in the body, one of the things it does is it competes with glucose for the same receptors, which let me put a warning on there right now, because I've had patients run into this issue because they forgot my warning. Vitamin C, because it competes with glucose for its receptors, if you do a finger stick blood glucose test right after a high dose vitamin C IV, it's going to read super high. It's going to read your sugar might be 300 or 400. And you might be feeling, diabetic especially, might be feeling really shaky and out of it. And they might think it's because their sugar is too high. It's not. Their sugar is actually too low and they need to eat. So that's just my little warning on it.
I remember when I came into your clinic one time and I did a high dose vitamin C and I had a CGM on because I was using it at the time to fix my pre-diabetes to make sure my glucose stays stable. I started freaking out because it was like 200, 300, 400, 500, 600, and then it went off the top of the graph. And I was like, am I dying right now? It's like, is this normal, Dr. K?
Yep. And so for you, you're just watching, you're like, oh my God, it lasts for about 6 to 8 hours. So where it affects the blood glucose reading. For you is kind of just scary to see. For type 1 and 2 diabetics, it could be dangerous if they don't remember that.
Yeah, because dosing with insulin can put them way too low.
Yep.
Yeah, that makes sense. Yeah, I was like, what the heck is going on? That's one I didn't expect.
Mm-hmm. Yeah, I like that you had it on at that point. Like you told me afterwards that you had it on. I was like, oh.
Okay, so antioxidant in low doses, orally, probably 1 to 2 to 3 grams a day. Pro-oxidant, IV, north of 15 grams. You probably can't get that much orally because you're going to have disaster pants.
Yes.
So using it helps with tissue building. So after regenerations is kind of a great time to regeneration injections is a great time to use this high dose vitamin C to help rebuild whatever is needing to be rebuilt from the injection.
Yep.
Okay. So vitamin C can detox us, right?
That's been a saying going around. I know there's doctors out there that say, because I'll get patients that come in once in a while and said, I don't need to do chelation. My other doctor said I could just do vitamin C and chelate it. And so actually last night, I came across an interesting study, the one they were talking about this morning, where they compared oral DMPS with IV DMPS with DMSA with vitamin C. And so we've talked about oral versus IV DMPS and DMSA, so we don't need to get into that. But this was an article that compared vitamin C to it. And basically the article says, 20 years ago, this was a saying that vitamin C chelate you, and we looked at it and we realized that no, it doesn't work.
It doesn't have any thiol bonds, so it has nothing to grab the actual heavy metal.
Basically, and then you had a theory about why people used to think it would.
I thought it was just because when you detox and you run vitamin C along with it, it's a great support agent. So it'll help minimize the side effects, the detox side effects, the Herxheimer reaction, these metals coming out, how you feel. So if you run it next to each other in conjugation with chelation, it's actually very good for your system and can help you be protected from the side effects. But I never thought it was really a detox agent.
Yep. And then last thing I want to point out. So I get people that come in once in a while and they're like, oh, I'm sick, I don't feel good, I want to do a high dose vitamin C IV. That's a terrible idea. You're probably going to feel worse before you feel better. High dose vitamin C, it will help fight the infection, but for some reason it makes the symptoms a lot worse while it's doing it. And so I've tried it myself too. I was like, when I first started, I was like, oh, I'm really sick, I don't feel good. I did a high dose vitamin C. It felt even worse for the next 2 days. So not the best anti-acute illness IV. Low dose vitamin C, a few grams like we do in our vitamin cocktails, is a much better dose in my opinion.
It leads me to my ultimate immune stack for supplement. So I actually just had my wife on this because she got sick probably a week ago, and she was starting to feel off one day, and then it was full on sick the next day. I put her on this protocol, and then she was 80% better the next day. I was like, boom. So it is vitamin C, 2 grams a day, vitamin D, A, K, and E. When you're sick, I like to aim for about 10,000 IUs of the vitamin D. It's usually about double what most people take daily. Zinc and elderberry. So those 4 stacked seem to be the 1-2 combination of it won't necessarily, it might prevent you from getting sick, but it's more reduces the time and the severity of it.
Nice. So yeah, fun little side tip.
Yeah, that's my ultimate immune stack.
Yeah.
So anything else on vitamin C?
I think that's a pretty good overview on it. If any one of our 12 listeners has follow-up questions and wants to hear more about vitamin C and more specific things, shoot us a message, comment on our Instagram posts about it, and we'll have a more in-depth vitamin C if there's demand for it. I didn't want to overwhelm people by getting into the nitty-gritty of vitamin C if not enough people actually care to hear the nitty-gritty.
That's fair, and that's probably pretty good because I don't know much more about it than what we talked about today. Even this was stretching my knowledge on vitamin C. Well, thank you, ladies and gentlemen, for listening to the Peak Performance Podcast. I'm Coach Kyle, and you can find me on Instagram at ToxinFreeKyle.
And I'm Dr. K, or the OsteoDoc on Instagram. Thank you for joining us, and we'll see you guys next time.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.